Here is a complete, well-structured narrative lecture script that covers everything shown in your teaching board on PUD and GERD drug summary. You can use this for teaching, recording, or exam review. Peptic Ulcer Disease, PUD and GERD comprehensive drug summary. Peptic ulcer disease and gastroesophageal reflux disease are both acid-related disorders. Management focuses on 1. Reducing gastric acid secretion, 2. Neutralizing existing acid, 3. Protecting the mucosa, 4. Eradicating Helicobacter pylori when present, 5. Improving gastric motility in GERD. H2 receptor antagonists, H2 blockers. Mechanism of action. These drugs block histamine H2 receptors on parietal cells, CAMP gastric acid secretion. Drugs, cimetidine, ranitidine, withdrawn due to NDMA contamination, famotidine, nizatidine. Effects, decrease acid production to 70%, onset 30 to 60 minutes, duration 4 to 10 hours. Drug-specific points, cimetidine, CYP4450 inhibitor, many drug interactions, anti-androgen effect, gynecomastia, impotence. Ranitidine, withdrawn from market, NDMA contamination. Famotidine, more potent, 20 to 40 cabs stronger than cimetidine. Nizatidine, primarily renally excreted. Exam pearl cimetidine, gynecomastia, very high yield. Number 2, proton pump inhibitors, PPIs. Check. Mechanism of action. Irreversibly inhibited HK ATPase proton pump in parietal cells, final step of acid secretion. Drugs, omeprazole, esomeprazole, pantoprazole, lansoprazole, rabeprazole, dexlansoprazole. Dual delayed release. Key properties. Most effective acid suppression, 80 to 95%. Irreversible inhibition, duration 24 hours. Take before meals. Adverse effects, long-term use. Hypomagnesemia, hypocalcemia, vitamin B12 deficiency, osteoporosis risk. Important drug interaction. Omeprazole inhibits CYP2C19, reduces activation of clopidogrel. Special note, pantoprazole is preferred when patients are on clopidogrel. Exam pearl, most potent acid suppression equals PPIs. 3. Antacids. These neutralize existing gastric acid. Key characteristics, rapid onset, minutes, short duration, 30 to 60 min, can reduce absorption of many drugs. Types and side effects, aluminum hydroxide, constipation, magnesite, diarrhea, calcium hypercalcemia, acid rebound, sodium bicarbonate, metabolic alkalosis, sodium retention. Exam pearl, diarrhea, magnesium, constipation, aluminum. IV, mucosal protective agents. These protect gastric lining rather than suppress acid. 1. Misoprostol, PGE1 analog, acid, mucus, bicarbonate, used for NSAID-induced ulcer prevention. Contraindicated in pregnancy, causes uterine contractions. 2. Sucralfate, forms protective barrier over ulcer, requires acidic environment, do not combine with PPIs or H2 blockers. 3. Bismuth subsalicylate, antimicrobial, mucosal protection, used in traveler's diarrhea, used in H. pylori therapy, causes black stool and black tongue. Exam pearl, black stool tongue, bismuth. V. Antibiotics for Helicobacter pylori. H. pylori causes chronic gastritis and peptic ulcers. Antibiotics, acillin, cell wall inhibitor, clarithromycin, protein synthesis inhibitor. Metronidazole, DNA damage, metallic taste, disulfiram-like reaction, avoid alcohol. Tetracycline, ribosome inhibition, photosensitivity. H. pylori treatment regimens, triple therapy, 14 days, PPI plus clarithromycin plus amoxicillin or metronidazole. Bismuth quadruple therapy, preferred, PPI plus bismuth metronidazole tetracycline. VI, prokinetic drugs, GERD, used when GERD involves delayed gastric emptying. Metoclopramide, GI motility, LES tone, gastric emptying, antiemetic, crosses blood-brain barrier. Adverse effects, extrapyramidal symptoms, sedation, prolactin. Domperidone, similar GI effects, does not cross BBB, fewer CNS side effects. Exam pearl, extrapyramidal symptoms, metoclopramide. SEPT, GERD pharmacologic treatment hierarchy. 1. Antacids, mild symptoms. 2. H2 blockers, moderate symptoms. 3. PPIs, first-line chronic therapy. 4. Prokinetics, delayed gastric emptying. Varied, PUD causes, Helicobacter pylori, NSAIDs, stress, smoking, alcohol. NSAIDs cause ulcers by decreasing prostaglandin synthesis, mucus bicarbonate injury. IXPU complications, bleeding, perforation, obstruction, gastric cancer, X. Ultra-high yield exam facts, most potent acid suppression, PPIs, gynecomastia, cimetidine, PPI interaction with clopidogrel, omeprazole, NSAID ulcer prevention, misoprostol, black stool tongue, bismuth diarrhea, magnesium constipation, aluminum, extrapyramidal symptoms, metoclopramide. Final clinical integration summary. For acid-related disorders, use PPIs for strongest acid suppression. Use H2 blockers for moderate symptoms. Use antacids for quick relief. Use misoprostol for insect protection. Use sucralfate when mucosal barrier support is needed. Eradicate H. pylori with combination therapy. Use prokinetics in GERD with motility issues. If you would like, I can now